So today I'll be talking about an introduction to commonly encountered scenarios when synthesizing systematic reviews and overviews. So this has been the topic of my PhD and my postdoctoral research, and I'm based now at the Cochrane Hypertension Group and the Therapeutics Initiative at the University of British Columbia in Vancouver, BC. My email is down here, and if you're tweeting me, please hashtag overviews as well. Thanks. So I'll be doing today basically an introduction and background to overviews. I'm going to basically have it in mind that people don't know what overviews are, so I'll be giving a thorough definition of overviews as well as examples. I'll be describing unique challenges in overviews and how to summarize methods used to deal with unique challenges, or what I call scenarios in overviews. And then I'll be providing examples of methods throughout and talking about future research as well. So what's an overview of reviews? An overview of reviews synthesizes the results of systematic reviews, much in the same way that systematic reviews use, for example, randomized controlled trials or observational studies as the unit of analysis. So overviews of reviews are called many different things. One of them could be umbrella reviews, another one could be meta reviews, reviews of reviews, reviews of meta-analyses, systematic reviews of reviews. The list is quite long because researchers haven't really come to consensus about what to call them yet. So overviews are a response to the information overload. And the production of systematic reviews has steadily increased over the past 30 years, making the task of keeping abreast of the literature very challenging for clinicians and policymakers and healthcare providers. So in 2016, John Ioannidis wrote an article in the Billy Bank Quarterly called "The Mass Production of Redundant, Misleading, and Conflicted Systematic Reviews and Meta-Analyses," where he said that the production of systematic reviews and meta-analyses has reached epidemic proportions. So global research output as a whole is growing rapidly, and it's estimated that every 9 years, the publications in the Web of Science more than double. So similarly, there's been an increase, a tenfold increase actually, in registrations in the Prospero database for protocols of systematic reviews in the past 5 years. And the number of published systematic reviews is rapidly expanding as well. As you can see in this table here, where you could look at the number of identical systematic reviews on these different topics, which is on the left. So for example, we have the topic of vitamin D supplements to prevent fractures, where these researchers have found 24 systematic reviews and meta-analyses on that topic. So faced with a very large volume of information and systematic reviews on the same topic, healthcare providers, they have to make sense of potentially conflicting reviews, findings of reviews, overlapping information, and overviews are one way to be able to deal with this information overload. So there's been a steady increase as well in the number of overviews that have been published over the past recent years as a result of this expanding volume of systematic reviews. So here in this graph, I just did a very quick search of the Epistemonicus database for the number of published overviews per year, and I found 650 overviews were published between 2008 and 2017, with around, and this is a very approximate number, but with around So I just wanted to segue into what I consider to be components of a high-quality overview. And I'm doing this first so that you get a sense of what a good overview is, so that when you do read one, you'll be able to recognize it. So first of all, a high-quality overview contains a clearly formulated objective designed to answer a specific research question. And this aligns with the recent Cochrane Handbook chapter on overviews, which says that Cochrane overviews use explicit and systematic methods to search for and identify multiple systematic reviews on a similar topic for the purpose of extracting and analyzing their results across important outcomes. So I just wanted to give you an example of an overview with a broad question, because overviews are often used for broad research synthesis and policy development. So this is an overview of assisted reproductive technology, which is an Cochrane overview. So it's an overview of Cochrane reviews only. And this overview synthesized the results of multiple systematic reviews and had many, many outcomes that they had to synthesize as well. So it had 59 systematic reviews, which were grouped into 18 intervention and population categories. And so this question type was different interventions for the same condition or population. So they looked at different reproductive technologies for the same condition. So this question type was, this overview was a different question type, so it looked at different applications of the same intervention for the same condition. So here it looked at sumatriptan, all routes of administration for acute migraine attacks in adults. And here they actually synthesized 4 Cochrane reviews. They looked at the efficacy and tolerability of sumatriptan in 4 routes of administration, namely oral, subcutaneous, intranasal, and rectal. Another different type of overview looks at adverse effects of an intervention. So this one is there a higher failure rate of allografts compared with autografts for ligament reconstruction? So it's a systematic review of overlapping meta-analyses. And it identified reviews that address the same question and resolved discordant results or conclusions from among those 8 systematic reviews of meta-analysis. And here is another type of overview. It's not very prevalent because of the problem with overlap, which I'll be talking about coming up in the next few slides. But this is an overview called Pooling Systematic Reviews of Systematic Reviews, a Bayesian panoramic meta-analysis. And here this question type was the same intervention for different conditions. It synthesized 11 systematic reviews with meta-analyses, and it looked at 13,661 observations. It's called a panoramic meta-analysis because it pooled meta-analysis estimates to obtain one overall meta-analysis effect estimate. So the second component of a high-quality overview is that it primarily aims to search for and include only systematic reviews and with or without meta-analysis. So the eligibility may be restricted to specific types of reviews here. So we all know that there's a million types of reviews, such as scoping reviews, evidence maps, there's rapid reviews. But here the authors should have a definition of whatever type of review they decide to incorporate and include. So for example, systematic reviews, the definition would be that they're summaries of primary studies that address a clearly formulated question using systematic and explicit methods to identify, select, and appraise research and collect and analyze data. The third component of a high-quality overview is that it uses explicit and reproducible methods to select systematic reviews. So this means that they're going to have 2 people that are independently selecting studies in duplicate, and they're going to be comparing their results to make sure that there's no missed studies. And then finally, that they intend to collect, analyze, and present the descriptive characteristics of those systematic reviews, the risk of bias of those systematic reviews, as well as the included primary studies. And as well, they present quantitative or qualitative outcome data or both. And they do an assessment of the certainty of the evidence, which is mostly characterized by grade assessments. So they may have done one of these things, they may have done all of these things, but they have to do at least one of these things, which is present the results of the systematic reviews. So these are the different types of reviews, and I just wanted to give you an overview of what these reviews do and what methods they use, and then highlight how overviews are different from these. So on the top in the blue, we have overviews, systematic reviews, scoping reviews or evidence maps, and network meta-analyses. So on the left here we have some of the main methods. So one of the methods is it aims to synthesize the results of systematic reviews. Systematic methods used such as searching the literature, selecting studies, extracting data, risk of bias assessment, analysis of results from systematic reviews, analysis of results from primary studies, and assessment of the certainty of the evidence. So here we see that on the top, the aim of an overview, the main aim of an overview is to synthesize the results of systematic reviews. And systematic reviews, scoping reviews, network meta-analysis don't have that aim. So they may include or search for systematic reviews, but they don't analyze the results of those systematic reviews. As well, one of the main differences is that overviews analyze the results of the systematic reviews, either qualitatively or quantitatively, and this isn't done by these other types of reviews. So these are very important distinctions. So as I said before, these types of other types of reviews, such as systematic reviews, scoping reviews, network meta-analyses, they may collect or search for systematic reviews, but they don't aim to synthesize the results of those reviews. And all of these types of reviews do use systematic methods, so I do want to emphasize that. Okay, I'll now move on to talking about the challenging scenarios unique to overviews, and I'll first go over how we came across these scenarios and the methods that we used. So methods for conducting overviews have not been very well established as opposed to systematic reviews, which have been under development. Methods have been developed for systematic reviews over the past 30+ years. So unique methodological challenges occur with overviews which don't have any obvious solutions. There is some guidance, but a lot of the methods, a lot of these scenarios don't have any clear guidance. And current practice, so for researchers doing overviews, it's mostly driven by personal experience from doing multiple overviews and seeing what works, and trial and error. And so far there's been no real consensus about which methods are reliable, valid, useful, and efficient. So there's many different methods papers that have identified that looked at scenarios for overviews. So most of these look at a cross-section of overviews and then see what methods these papers have used, actually, these overviews have used. So our objectives were basically to identify and describe common scenarios that present methodological challenges for overview authors, and identify and describe methods to address each of these scenarios. So we published 2 papers as a result of this research. The first one is about the purpose, eligibility, search, and data extraction, and the second one on the right is the risk of bias assessment, synthesis, presentation, and summary of the findings, as well as assessment of the certainty of the evidence. So it's methods for all of those steps. So when we developed a MORE framework, so it's methods for overviews of reviews framework, the MORE framework. And to do that, we actually collected all of these studies that describe methods used in overviews. The studies that we ended up including were studies examining a cross-section or cohort of overviews. We also collected commentaries or editorials which may inform methods that are used in overviews, as well as guidance documents. We ended up searching methods collections, Medline. We did reference checking of the included articles, and we did forward citation searching as well. And for our analysis, we ended up doing a qualitative analysis to identify all the methods in the MORE framework. We categorized them based on the main steps in how to conduct an overview, which I'll go over in a minute. And then we populated our MORE framework with the identified methods. After that, we identified common scenarios that we saw throughout all of the papers that we ended up including, and we mapped the methods that we found in the MORE framework to these scenarios to be able to provide you with solutions, what methods could provide solutions to these scenarios. So the main steps in how to conduct an overview we see here on the left. So the main steps, as we know, are definition of a purpose or objectives or scopes, eligibility criteria, searching, data extraction, assessment of risk of bias, assessment of the certainty of the evidence, and the synthesis, presentation, and summary of the findings. So we ended up categorizing these methods based on these broad categories. So we identified studies which contributed data to each of these steps, each of these stages, and then we coded the articles to identify and categorize methods relevant to each of these steps, and then sub-steps from there as well. And what we ended up doing is we had two people independently code all of these studies for the methods and categorize them, and then once they were categorized by each researcher independently, we came together and we compared our coding and our categorizations to make sure that they matched up, and then we ended up changing it, refining it, and through meetings that lasted years, we ended up coming up with a more framework. So I'll just go over our findings now and present the actual scenarios that we identified that were unique to overviews. So we identified 42 method studies, which were included in the Moore framework. We identified 7 common scenarios that were identified. We mapped multiple methods to each of the scenarios and at different steps in the process. Some of these methods and steps which can be combined, which I'll go through right now for you. So these are the 7 steps, these are the 7 scenarios that we identified. So, and I'll go through 8 of them really slowly. So the first one is that systematic reviews include overlapping information and data which arises from primary studies which are included across different systematic reviews. Systematic reviews report discrepant information and data as well as missing data. Systematic reviews may report discordant results and conclusions. Systematic reviews provide incomplete coverage of the overview question. So for example, if we're looking at, if we have a PICO question, but then the actual studies that we're including, the systematic reviews including don't address those PICO, then there's going to be gaps. And so that means that there's going to be incomplete coverage of our overview question. The reviews that we end up including may be out of date. What do we do about that? And as well, reviews raise concerns about bias and quality, so they may not have been done rigorously. So I'll only have time today to talk about 3 of these scenarios, so overlapping information and discrepant and missing data. So I'll first talk about overlapping information and data across a cohort of systematic reviews. So what is this problem? What is the problem of overlapping information and data? Overlapping data from primary studies reported across multiple systematic reviews can include different types of overlapping data. So it can include risk of bias, overlapping risk of bias assessments, overlapping pooled effect estimates across the same outcome. It can include overlapping meta-analysis results such as I-squared heterogeneity statistics. And it can also include overlapping certainty of the evidence or grade assessments across the same reviews. So I'm just going to stop and sort of give you an example of overlap in primary studies across 3 systematic reviews in an overview that was done of aromatherapy for dementia. So the 3 reviews that were included were one by Forrester in 2014, another by Nguyen in 2008, and another by Fung in 2012. And this gray area represents our overview question. So all of the studies within the gray sphere, for example, will contain all of the information relevant to our overview question. So all of the blue are unique studies, so studies that are unique within this sphere. All of the green studies are the ones that are excluded. So here on the left and the right, we've excluded these because they don't address our overview question. And as we see, there is 1, 2, 3, 4, 5, 6 studies that are unique and 3 studies that are overlapping. And so they're overlapping from the Nguyen and the Fung reviews. So I'll just continue this example of overlap. So we have our 3 reviews on the left here by Nguyen, Fung, and Forrester. And then we have our trials on the top in blue, all the way from Mitchell to Fu in 2018. So this is the amount of overlap. So we see that there's quite a bit of overlap in the trials across these 3 reviews. So what do we actually do about this problem? So some of these trials appear in multiple reviews. So we have several options. So one of the most simplest options is we can develop some inclusion criteria. So we're going to say we're going to select only one review. What type of review? So I want to include, for example, the most recent, the most comprehensive review. So the review with the most number of trials. And this happens to be this trial by Nguyen, which contains 8 trials. So if that's my decision, then I end up missing out on another 5 trials. I could also make the decision to include only the highest quality review, and this might be the review by Fung, which included 6 trials. But then again, I'm missing out on another 6 trials here. Or I can make the decision to include another review by Forrester, which happens to be the most recent review, right? So it's recent, so I think it might have the most recent information, which it does, which we could see by these more recent trials on the right. However, then we do leave out these other 6 trials. Alternatively, what we can do is we can include all of the trials. But this presents problems because now we have the problem of overlap that we have to deal with at the synthesis stage. So why is this a problem? So overlap and effect estimates from pooled meta-analyses give undue statistical weight to studies that are duplicated and produce overly precise estimates. So basically, you're double counting participants in these trials that are overlapping, which we don't really want to be doing. So I'm going to now go through some of the methods that we can deal with, either to report or resolve some of this overlapping data. So here at the specification of eligibility criteria step, which we see on the left here, we have several options. So we can include all systematic reviews and deal with the overlap at a different step. Or we could select one, which I mentioned before, review using pre-specified eligibility criteria, and we can combine that eligibility criteria as well. So we could say that we want the highest quality review that has the most trials and is the most recent. We can also do that if we have like a large amount of reviews that we could choose from. At the data extraction step, which is very similar, we may decide to extract all the information from the reviews, or alternatively to extract information from only one review that we ended up choosing. At the synthesis step, we again have multiple options, so we can decide to quantify the amount of overlap to see if it's actually a real problem. We can visually present it in tables and figures. And again, we could select one review, for example, the highest quality review. We can also decide to deal with it statistically, and the ways we can do that are to eliminate systematic reviews with the least studies and the ones that are overlapping. We can conduct sensitivity analyses, or we can inflate the variance of the pooled meta-analysis estimate. So I'll just give you a quick example of one real-life overview that actually had to deal with overlap, and I'll show you what they decided to do. I think it's actually a really great example. So this was prepared for the Agency for Healthcare Research and Quality, and this is an overview on behavioral counseling and pharmacotherapy for tobacco cessation in adults, as well as pregnant women. And this was done by PatNode, and that was actually done in 2015. So the authors used several different methods to deal with overlap. So one of the methods that they used is at the eligibility criteria they chose to include systematic reviews using pre-specified eligibility criteria. And here they quote, they said, generally we included studies if they were systematic reviews with or without meta-analysis. They also decided at the assessment of risk of bias to assess all the risk of bias of all the systematic reviews, and they ended up excluding all poor quality systematic reviews. And then at the synthesis step, they ended up quantifying the amount of overlap, and so they say here, next we compared the included primary studies within each review to evaluate the comprehensiveness of each review. They also selected one systematic review based on a decision algorithm that they had. So here they say that we identified one or more reviews that included the most comprehensive, so that had the most, the greatest number of studies, which was up to date and was the highest quality to serve as their primary review. And that's on each of the behavioral intervention topics that they had. They also chose to visually present overlap in tables and figures. And here we see one of their tables, which was in the appendix, and here we have the reviews in yellow on the top, and the primary studies here in kind of a salmon pink on the left. And for example, we see here that this Abrams 2008 primary study was included in both Brown 2013, which is on the right in yellow, and Chen 2012. So that's the overlap that we see in tables. They also ended up doing a figure, which is a very complicated figure, which I won't have time to explain to you now. But so, for example, some of the trials are, some of the actual included studies are represented by these squares, circles, and triangles. So I'll now move on to show you methods that can be used to resolve discrepant information and missing data. So what is it? So here I mean by discrepant, I mean different information or missing information from the same primary study that's reported across a series of reviews. So for example, if we have one trial which is reported across 3 different reviews, it may report different aspects of PICO or different effect estimates, for example, and so we need to resolve that, that discrepancy. They may also report different data for differing data for the same comparison, for example, or differing risk of bias assessments or differing grade assessments. So here's an example of discrepant risk of bias assessments across these 3 reviews that we have seen before by Nguyen, Fung, and Forster. So here we find that risk of bias assessments that were done using the Cochrane risk of bias tool across these 3 reviews were done for 5 trials. However, 3 of these risk of bias assessments had different judgments for the same study. The one for Smallwood had differing risk of bias assessments. Gray and Lin also had differing risk of bias assessments. So why does this happen? Why is there differing assessments or data reported across across different reviews for the same study, for example? So this can occur from errors through data extraction. Maybe data are extracted from different sources for the same primary study. For example, perhaps authors got different reports for that same primary study, or maybe they got some unpublished data from a clinical trial registry, for example. Data could have been retrieved by contacting primary study authors, for example, or systematic review authors as well, and that could be one of the reasons for discrepancy as well. And there's a lot of other reasons. So what are some of the methods that we could use to deal with this discrepant or missing information? A lot of this is, just has good faith validity, so things that you would just normally do as good measure. So for example, we have the option at the eligibility criteria step, so we can include all of the information from all of the systematic reviews and then deal with the discrepancy later on, or we could choose to just select one systematic review, for example. At the data extraction step, again, we can choose to extract all data or extract data from one systematic review. And then at the data extraction step, we have a few more options here. So we can retrieve reports of the primary study, so go back and actually get those primary study reports ourselves. We can contact systematic review or trial authors for missing information. We can search for the information in systematic review or trial registries as well. And then there's also other methods that you could use at the risk of bias assessment, the synthesis step, and at the certainty of the evidence assessment steps as well. But these are just some of the options that you have. So all of these methods have methodological impacts. So for example, you have trade-offs when you decide to use one of these methods, and one of the big ones is that you may, for example, by choosing one systematic review, have a huge loss of information. However, including all systematic reviews can introduce problems such as overlap and other challenges. However, doing nothing about it, just sort of ignoring, for example, overlap, can affect the validity and reliability of the overview findings. And using methods to resolve these challenges is very resource intensive. So for example, if we decide to go back and look for all the primary study reports and then extract that information and cross-reference it to the information in the systematic reviews, this process is going to be labor intensive, and sometimes we just, as authors, don't have the resources to do that. However, it's just really important that we're very transparent about what we're going to be doing. So choosing between methods really depends on the reviews that we're looking at. So not just the type of reviews, but the topic of the reviews and how well reported those reviews actually are. And so far, no empirical studies have tested any of these methods. They've done a little bit of testing. So for example, there's been a method by Dr. Dawood Pieper to quantify overlap, and there's been other studies as well, but in general, there's very little out there empirically about testing any of these methods. So in conclusion, 7 scenarios unique to overviews were identified. The 7 scenarios are overlap of information and data across systematic reviews, systematic reviews that report different or discrepant information and missing data, systematic reviews that report discrepant results of conclusions if they're based on the same topic, reviews that provide incomplete coverage of the PICO question, and systematic reviews that are not up to date, or methods that raise concerns about bias or quality across reviews. So multiple methods can be used at different steps, some of which of these can be combined in sort of decision algorithms. But I just want to emphasize that there's no one best way. I'm not going to be recommending one method over another because it really depends on your personal overview research question and the set of reviews that you're actually looking at that need to be synthesized. However, I want to emphasize that careful planning of these methods using the MORE framework could really help to ensure transparency and rigor of the methods. It will help with the usefulness of the findings, and it'll also help with reporting the completeness of the information. So I wanted to just conclude by sort of saying what future research is happening around overviews now. My group from Australia, Cochrane Australia, just recently put out a publication, and what we did is we looked at overviews and methods reported for handling overlap, discordant, and problematic data to see what a cohort of overviews actually did. And what we did is we came up with a sort of set of reporting items which can be used for protocols. However, this set of items hasn't gone through a Delphi process, and so it's right now just a preliminary set of items. However, there is a group by Lisa Hartling in Alberta, and they're doing a reporting guideline for full text overviews. So it's not just method sections, it's also all steps in the full review process, including results and conclusions. And their reporting guideline is called the Prior, and they're now undergoing Delphi survey. And if you're interested, please get in touch with Lisa Hartling's group, and you can actually do this Delphi survey if you're interested. I'm also starting and doing a bibliometric study of all overviews in Medline, and so we ended up screening 9,000 citations, and we're going to, it's like approximate right now, we'll probably get a cohort of about 700 overviews that were published between 2000 and 2018. And we'll be looking at some of the characteristics of those overviews, so how many authors, where the authors are located, where it was published. And I think all of this information, as well, potentially if this information was used, say, for example, in a clinical practice guideline. So I think this study will be useful for moving forward for identifying methods guidance as well. And then finally, we're just going to be submitting a study on the impact of overviews in a random sample of clinical practice guidelines to see if overviews or reviews are used in guideline development. So I'd like to just acknowledge my co-authors of the MORE framework, which are Dr. Joe McKenzie, Steve McDonald, and Sue Brennan. And I'd like to thank my funding for my postdoc with the Cochrane Hypertension Group and the Therapeutics Initiative. And thank you, and I'll just take questions. All right, so we have about 20 minutes for questions, so that's good. And for people online, I've unmuted you. So if you'd like, maybe I'll take questions from the people that are online first. What about people in person? Does somebody have a question? Yeah, so yeah, I'll repeat the question. So Benji asked, is there sort of a rule of thumb for how many reviews can be included in an overview? So I've seen, so from our research, I've seen anything from 2 reviews to, 20 plus reviews, or 90 reviews. It's been a real mixed bag of how many they include. But I can actually, yeah, I mean, there has to be at least one, but I haven't seen an overview with just one before. Yeah. And you can imagine the more reviews that you end up including, the more complex the job will be, So I think probably it's only these big, so I showed you the example of PatNode from the US, and they had, I can't remember how many they had included, but it was an astronomical amount, like maybe 60 reviews across all the behavioral interventions that they had. But they're a well-funded group, with several, multiple researchers working on that type of overview. So I think it really needs, if you're going to be doing a broad overview, it needs a lot of labor-intensive work and a lot of resources. But potentially these types of overviews are very useful, right? Because it gives you information about which interventions, like for example, government should roll out. One of the things I actually did want to mention is that a lot of times, I think in the beginning of the literature about overviews were sort of confused with network meta-analyses, and I think now that the literature on network meta-analyses, people are recognizing that overviews shouldn't be used in conjunction with a network meta-analysis. So now when you're doing a quantitative analysis in the context of an overview, what you might do is you might have a table, for example, with all the effect estimates, all the meta-analyses, in a table and show it that way. However, you may also decide that your studies are quite unique, and you might want to meta-analyze them, even though you've also looked at, say, for example, the risk of bias of the systematic reviews, and you've reported that, and you've also reported the quantitative results of the systematic reviews. You may want to go ahead and do a meta-analysis based on unique primary studies. However, it's not appropriate to go ahead and do a network meta-analysis, because a network meta-analysis has a problem of what we call transitivity. So basically, all the randomized control trials have to have the same population and the same interventions, and in a lot of cases, the same comparison as well. Those all have to be defined quite similarly so that you don't violate this transitivity assumption. So an overview may not be the best design for starting an overview. So usually what we see now is systematic reviews with network meta-analyses. Do we have any other questions?
Carole, Julian Little from Ottawa, thanks for your presentation. One thing that comes to mind, just as I've been reflecting on what you've been saying, is would you make a distinction between an overview and an umbrella review?
Yeah, so I think that kind of segues into what I was just talking about. So I think there was I can't remember what the date of that article was, by Johnny Ioannidis actually said that umbrella reviews could be used in conjunction with a network meta-analysis. But as I said, there's that tricky question about if you are actually searching for and selecting systematic reviews, you'd have to do a lot of that work of unpicking that PICO question of that systematic review and making sure that it really relates back to your, umbrella review question, for example, and making sure that the relevance of the question in the reviews actually matches your umbrella review question very closely. And so I don't think you really want to be going there. I think it's probably better to have a systematic review with a network meta-analysis. But I'm curious to know what your opinion is.
I mean, I've been thinking about it probably in a different context of actually trying to pull together mixed bag evidence, for example, on something like vitamin and disease. So there's been an umbrella review, for example, done at vitamin D. In other areas, you might be trying to put together some observational evidence, some trial evidence, and some Mendelian randomization studies. You wouldn't be doing, in that context, I don't think you'd be going near network meta-analysis.
And that's because your questions are very different. Is that why, or why do you say you wouldn't do that?
The questions are the questions for each of those different types of evidence are from each of those types of evidence. The detail of the question is different, but you're trying to get together an overall inference about whether it's a good idea for people to take more vitamin D.
I mean, maybe in that context, starting a scoping review of all that evidence first to see if there's any trends in that evidence, and looking at the actual volume of evidence would be a better idea. And then once you decide, what types of studies may be good at answering that question, you might decide, based on your scoping review, what type of review you might be doing after that. Whether it's a systematic review with a network meta-analysis, or whether it's an overview reviews, or whether it's a systematic review with meta-analysis.
Yep.
Any other questions?
Hi, this is Satya Karinanandan, also from the University of Ottawa. I also have a question related to, decision making when to conduct an overview of reviews. And I guess my question, and particularly, in the context of what you just told us about overlapping data and having to exclude reviews when in your overview of reviews, when would you have any comments on when you would decide that a new systematic review is more appropriate than conducting an overview of the reviews?
Yeah, I think there's a lot of reasons why you might decide to do a systematic review with meta-analysis. I mean, one of the classic ones is, say, for example, you end up collecting, 5 reviews, and you find out that all of them, had some sort of, they were just incorrectly done, had biases in them. For example, there was like a lot of publication bias, or maybe they had selective outcome reporting in them, and so there was major biases in maybe all of the reviews that you collected. And I think maybe that would be a good reason to conduct a new systematic review with meta-analysis. One of the other reasons may be that there is like a lot of overlap between those studies, and yet based on your research on those reviews and your assessment of bias of those reviews, you decide that perhaps unpicking those primary studies and doing a new meta-analysis might be the way to go. But as long as you have done, like say for example, you've presented the characteristics of those reviews, you've also assessed the risk of bias and presented those results, I think it's okay to go ahead and do a meta-analysis of unique primary studies within the context of an overview, as long as you have a strong rationale for doing that.
Thank you.
Thank you very much.